So we're here with Dr. Alfred Marquez. He's an El Paso native who has been doing private practice for over 35 years here in El Paso. Dr. Alfred Marquez actually graduated from UTHSC San Antonio School of Dentistry and is working for the Texas Department of Health before he actually before he became a dentist. So Dr. Marquez, let me ask you, with dentistry, what sets you apart from any other dentist, and why does integrative dentistry, what does that mean?
Okay, well, first of all, thanks for the intro. You weren't kidding, over 35 years. Yeah, I've been in practice for over 35 years. And yes, after I got out of dental school, I worked for the Texas Department of Health for a couple of years. And then I went into private practice. It certainly has been a journey. What sets me apart from other dentists, there's a lot of great dentists in this community, and dentists are good people. And perhaps what sets us apart is our philosophies. And I adopted a philosophy that says when we look at our patients, we need to look at the whole patient, the whole ball of wax. What is it about dentistry? How does the mouth integrate? How does it connect to the entire body? And our bodies obviously are made of a lot of systems, everything from our heart, circulatory, endocrine, hormones, digestive, reproductive, all of this is integrated. And certainly the mouth plays a big part. This is the first part of digestion. It starts here. Our mouth is important in our social connection with other people. I mean, just think of people that you look at. If they're missing a tooth, what do? You stare, it catches your eye. It's really strange the way that works, but the mouth is an integral part of this wonderful body of ours that's made of all these different systems. And that's why I like to consider my practice as an integrative practice, one that considers everything, one that considers how does the mouth play into everything else, and how does it reflect what might be going on in other parts of the body. That's integration. And that's where I think our philosophies might be a little bit different.
Dr. Marquez, you've been involved in dentistry for many years now.
Yeah.
How would you say experience plays a part in treating your patients?
So I can only speak for myself, but I think back years when I started, and I was eager and ready to go. I can honestly say that I was conscientious, I was very careful in what I did, as probably most dentists are when they start practicing. But I also realized that I had limitations as to what I could or couldn't do. And you have to acknowledge those limitations, and realizing that maybe there were certain things where I would refer out to other colleagues to get help in my treatment. But for sure, as you gain experience, like anything else, as you get better at what you do, you're able to take on more challenges and you understand things more. Dentistry is an ever-evolving field, and it's so different from when I first started to where it is today. But experience allows me to do a lot of other things I would have dreamed of when I first started school. I like to consider and look at the patient, understand what it is they need, and in my opinion, our practice is need-driven. Patient need-driven is what I like to call it.
So doctor, you talked about need-driven. What do you mean by need-driven?
Patient need-driven. So first of all, when a patient comes in, they're trusting me, and I acknowledge that, and I feel humbled that they would even consider coming in to see us, but they're looking for an opinion, they're looking for guidance into what might be alien them or maybe just for maintenance, but they have a need. And it's up to me as a practitioner to decipher what that need is. What is it that the patient wants? What is it that the patient desires? And I'm not interested in anything other than what is between the ears in the patient. What are they thinking? What do they want to accomplish? And what is it that I can do to help them accomplish that? Also, as a dentist, I feel that I'm an educator. I welcome skepticism. I think every patient has a right to ask questions. Why are you recommending this? What happens if I do? What happens if I don't do it? You know, it's not up to me to decide what the patient should do. I can recommend, I can educate the patient, but at the end of it, it's up to the patient to decide what's right for them. What might be right for you isn't necessarily right for me. It's an individual decision that we all have to make.
So when I look at Dr. Marquez's online reviews, and they're really good. So what do you have to say about your online reviews, Doctor?
So as far as that goes, well, I'm pretty humbled that we get so many good reviews, and the reviews aren't necessarily about me. I think the reviews are about the office, the entire team. I'm blessed to have just really, really, really an awesome team. A group of individuals that have adopted the same philosophy, I should say, that I have, where it's a patient first. We're genuinely interested in the patient and helping them with their problems. But my staff has been awesome from the front, from the time they answer the phone, to the time the patients come back, to the time that we start treating them. They're the ones that really shine, and I think together as a group we shine. And we just get those reviews, not that we're coaxing anyone to do them, but they actually come from the people's hearts, and I feel very proud of my entire team, but I also feel very appreciative of our patients, and when they give us a good review, it's just really a tremendous thing for all of us.
So Doctor, you get good reviews, you have a good standing. Do you encourage new patients to come to you?
Sure, absolutely. We're open, you know, and I tell patients, you know what, if you're interested in seeing us, look at our reviews, see what attracts you, look at our website, see, what kinds of things we do. If your thing is, hey, I want individualized attention, I don't want to go through a mill, come in, come out. I want to be able to really interact and talk with a human being. If you're interested in that individual, hassle-free, it's not let's get you in, get you out, but it's let's take time, let's look at what you need, let's talk about it, and if that sounds like it's something that any patient wants to do, they're always more than welcome to come to our practice.
So closing thought, what would you like everybody to know, Doctor?
I'd like to let them know that we're available. We're more than willing to answer questions, to help individuals, we're a family, and when a person comes in, we want them to feel like they're part of that family, and I think we're very successful at it. And maybe we're not the right fit for everybody, but certainly for a lot of people, I know we are. And I think our history speaks for itself.
I think it really does, and thank you, Dr. Marquez, for taking the time out of your day to answer the questions. Please go like, share, Dr. Marquez's Facebook page, his YouTube channel, and he does Facebook Lives every Friday, which is the Fun Fact Fridays. Make sure to tune in.
Most every Friday.
Most every Friday. So
I'm on vacay right now.
make sure to tune in though when he does do them
next week.
Next week.
Yes, they're fun. They're always fun to do, and we try to put out a lot of good information there that's helpful to everybody. So yes, absolutely.